So palliative care, we think, is a topic that is oddly confusing to patients, providers alike. And it's a very important part of the treatment process. So I'm curious to know, how is it that you incorporate palliative care in your treatment of patients with cancer?
So what do you understand about palliative care? What's your definition?
My personal opinion of palliative care is that it is sort of the overall care, but largely pain care for patients at all stages of their treatment, not just at the end of life, which is where I think the confusion comes in.
I guess the word palliation, right, means that you decrease symptoms. So that means that you have to have symptoms from cancer or treatment, and therefore the word palliative care is more targeted toward advanced cancers. But I think we all know that it is not just chemotherapy or targeted therapies, immunotherapies, hormonal therapies that actually can help cancer patients, but it's also the more integrative approaches, including acupuncture, including yoga, psychosocial support, emotional support, nutritional support, all of those that play into the bigger picture of helping a woman cope, helping her get through treatments, and to make treatments easier on patients, and to actually potentially improve also cancer outcomes. And so therefore, one way to utilize different terms would be integrative care, integrative health, which major cancer centers also offer. And there's complementary medicines as well. But the true word of palliative care is more applicable to advanced cancers. And I think they are very helpful because, for instance, having a woman who has been through multiple chemotherapies, suffering from nausea, vomiting, and from pain due to cancer progression can be helped, for instance, with marijuana, medical marijuana. And that's what our palliative care team would offer this woman. And so we can co-treat women, not just with the cytotoxic medicines, but also with other medicines that help stabilize appetite, help with mood. So antidepressants could be helpful, stimulants can be helpful, such as Ritalin in patients who have very advanced cancer. There are so many that you can add now to the armamentarium that having a palliative care specialist on board is actually very helpful. So in my practice, I try to introduce the palliative care team around the time when we probably switch from the first, second, third line metastatic treatments to the next line. When women generally feel well, but start to have symptoms that can be managed quite well with our colleagues in palliative care. But when it comes to integrative health, those should be accessible to women even with early cancers, because there's questions on survivorship, on emotional impact of treatments, nutritional support, physical activity support. There's so many opportunities out there that we can actually find for patients that I wouldn't just limit it to patients who have very advanced cancer.